Thank you for joining us this evening. My name is Valerie Ahern, and I'm the manager of the RIPIN Cedar program. And I'm accompanied this evening by the program supervisor, Jackie Aldana. We'll both be presenting this evening. If you have any questions at all, I ask that you just hesitate because we do have a question and answer page coming along soon in the program. But if you feel that it just can't wait, feel free to go ahead and put that question into the chat. And Sarah will let us know if there's something that we need to answer. I also just want to mention before we go on that this presentation is going to be available in Spanish on this Wednesday evening, which is April 19th from 6 to 7. And there is a link in the chat box if you're interested or want to share that. So our RIPIN Cedar Family Center right now currently has 6 care coordinators. It has a program director, program manager, me, program supervisor, Jackie, and we also have a clinical social worker for our program who looks over each and every family care plan that comes out of the program. So once again, thank you for joining us this evening and taking time to be with us to learn about RIPIN Cedar. So who and what is RIPIN? Let's start there. Who and what is RIPIN? RIPIN is a 501c nonprofit company that got started in 1991 by a group of parents who got together and realized they really wanted to help their own children and realized that together they could help even more. And they soon recognized that this peer-led model was so helpful and they could get so much more information out to others. And others really relied on the fact that they had already experienced what they were experiencing. And so from there we grew, and now we're just on a mission to help Rhode Islanders with everything. Our Cedar Center is just one of many different programs that are at RIPIN. We have a plethora of programs, and we assist consumers from birth right through the whole lifespan. And if you're interested, you can feel free to look at our website and explore all the programs that we have at RIPIN. We provide information, training, education, support, and advocacy for person and family-centered care and system change in the state. Next slide, Jackie. What is CEDAR? In case you don't know, CEDAR is a Medicaid-funded care coordination for kiddos with special health care needs and their families. And yes, we say and their families because a child is a member of a family and it takes the whole family unit to work together. We ensure that a child's needs and the family's needs are met. It's really important to understand that we don't do any of the direct service ourselves, but we're more of the bridge to the services that are available to families in the state of Rhode Island. We pride ourselves on being family-centered, and we access resources and services that may be available to these kiddos and their families, and we help them reach their potential and thrive in their community. Our peer professionals help Rhode Islanders access healthcare coverage, navigate healthcare, education systems, improve social determinants of health, and basically improve the health outcomes for the families with children with special healthcare needs. So you may be asking, how does a child qualify for CEDAR services? Well, they have to have Medicaid. That's mandatory. This includes Katie Beckett. They have to be a Rhode Island resident, also very important. They have to be between the ages of 3 and 21. Why those ages? Under the age of 3 in the state of Rhode Island, children are eligible for early intervention, and that is a more appropriate program for those younger kiddos, 0 to 3. Young adults over the age of 18 in the program through the age of 21, we do require power of attorney if they can't participate in the program on their own behalf. And they have to be a child with a special health care need with 2 or more chronic conditions, or have 1 chronic condition and be at risk for a second. They could also have a severe mental illness or emotional disturbance. and the child and family would greatly benefit from this intense care management. So part of the considerations that we take when we get referred families are, we sit and think, how can we best support the family? What natural supports have already been identified by the family or that we can help them identify? And our Cedar Center follows the RIPIN mission and vision, which leads us to how those referrals actually received. Well, referrals can be faxed, they can be emailed, and they can even be done over the phone on a confidential line that we have. Referrals can be made by the parents themselves, social workers, members of a child's school team, medical providers, really anybody who is involved in this child's life, grandparents, aunts, uncles that are with the child on a daily basis, whoever's caring for the child. So we get referrals from a plethora of sources. So what happens when you send that referral to us? What's the next thing? Well, the first thing we do is verify that Medicaid eligibility, because as we stated earlier, it is a Medicaid funded program and the child must have that. If you happen to have a child, and the family does not have Medicaid for the child, but thinks that they would be eligible, you're always welcome to have the family call our call center, who can help them with the steps to gain that. So after the Medicaid eligibility is completed, there's an intake coordinator, or sometimes even the assigned care coordinator contacts the family, and we conduct a thorough needs intake. That really includes presenting concerns for the child. What are the resources that are already in place, informal and formal? What barriers is the child or the family facing? What are their current and past involvements? What are they interested in? And with that information, together with the family, we make up an individualized family care plan, or what we call an FCP. Once that's developed, and sometimes along with the crisis plan, a meeting is held with the family to sign enrollment paperwork. In a later slide, we will discuss exactly what an FCP is and what it looks like. Once that occurs, then we roll up our sleeves and we provide family-centered care coordination directly with that family, with very frequent communication until all the goals that are set are met. We coordinate with the child's primary care physician, any of their medical providers, their medical team. We work along with their school, and we also send a copy of that child's family care plan to the child's primary care physician for their records if the parent allows us to do so. As I said a minute ago, we coordinate with the child's education team. We attend IEP meetings, 504 meetings, and other school meetings. If we can't attend, we certainly prepare the family for those meetings. And we go ahead and make referrals to outside agencies and community partners as appropriate. And sometimes we end up just being a sounding board for families because they're involved with so many different things, and we can help them process all of that and help them navigate where they want to go next. So what types of resources? What are the typically utilized resources? Well, there's transition to adulthood for those older young adults that we spoke about. CEDAR can support the families with what their options would be as their child approaches adulthood. There's also a transition for education that starts at around the age of 14 that we assist families with. There's the school support, which we also have our federally designated Parent Training Information Center under the roof of RIPIN, who assists us. They are the special education experts. And when we need answers to questions, we go to them as well. There's ABA, which is Applied Behavioral Analysis. There's PASS, which is the Personal Assistance Services and Supports in the state. There's HBTS. I know there's a lot of acronyms, sorry. HBTS, which is Home-Based Therapeutic Services, and there's Kids Connect. And in the next few slides, Jackie will go ahead and explain each of these resources to you.
Hi, everyone. The first resource we're going to go through is the Personal Assistance Services and Supports, otherwise known as PASS. And PASS is a family-directed service. It can be provided in the home or in a community setting. PASS is usually more so in the community. It can help improve a child's ability to do activities of daily life, maintain safety, especially in community settings, and gain some social skills. You know, there's some kiddos who might be really shy and, you know, ordering something like a soda at a store might be daunting to them. So PASS is one of those services that could potentially help with that. It's generally for children that are 6 years old and up, just because, you know, if it is in the community, we want to make sure the kiddos are at an age where they can be safe in that community as well. And families are recommended to obtain their own worker. The worker would need to be 18 or older, have a GED or high school diploma. Unfortunately, they cannot be living in the same home as that child or young adult. And they would have to be able to pass a BCI check, of course. And that being said, PASS agencies will also support in finding a worker as well. A similar program would be the respite program. And the way I like to best describe respite is it's babysitting through Medicaid. So it allows parents or guardians caring for a child with disabilities to have a bit of time or a care break for themselves. Typically, parents will be granted 100 hours a year. I believe that's been bumped up to 200 hours now. And those hours can be used however that parent or guardian deems fit. That could be, you know, let's say they just need some time to go out into the store, get their groceries done, or let's say they want to go get their nails done. They can use those hours however they would want to. To be eligible for the respite program, a child would need to have an institutional level of care. And the best way to describe that would be the type of care that could typically be provided in either a hospital, nursing home, or intermediate care facility. Same as PASS, families are recommended to obtain their own workers. It's the same qualifications as well. So 18, can pass a BCI check, have a GED or high school diploma, and cannot be living in the home with that family. And now here is another of our typically utilized services. This is the Home-Based Therapeutic Service, or HBTS. And HBTS is an intensive service which helps families of children with moderate to severe behavioral health, developmental or physical disabilities. It's typically provided in the home. They do sometimes go into schools, but I would say for the most part, it is home-based. Unlike PASS, the HBTS agency will hire a direct support worker, so that's not something that the parent would have to obtain by any means. And the HBTS worker would work with both the child and the parent or guardian. So, you know, if it is in the home, they're definitely expected to be in the home, you know, parent, child, and the worker. A similar program would be Applied Behavioral Analysis, or ABA. And this teaches appropriate behaviors to children who are on the autism spectrum, or if they have a related diagnosis as well. For those kiddos that, you know, struggle with picking up social cues on their own, usually with ABA, it is a lot of tabletop activities, a lot of repetition as well. And it teaches these kiddos skills with behavioral observation and positive reinforcement while teaching each step of a behavior. And ABA can be either in-home or center-based. Parents can definitely decide which fits more, you know, their lifestyle. And same as HBTS, ABA will hire the direct support worker. And it also works with both the child and the parent or guardian. Now, Kids Connect is a program that provides an additional staff member similarly to a one-to-one at a DCYF licensed childcare center that can help children with special needs participate, play, and learn along with their typically developing peers. Now, it wouldn't be necessarily all childcare centers. There is a list, which we will be sharing the link as well in the next slide, where, you know, those agencies would be eligible for Kids Connect. They are Kids Connect licensed. They do not pay for, you know, the child care center itself. So those fees the parent would have to pay out of pocket, but it would provide that additional staff member to, you know, be there to help support that kiddo. And if you want more information, or if you just need a refresher on all of these services, or even if, you just need to double check what that acronym is, we know we use a whole bunch of them. You can go onto EOHHS's website, and all of the fact sheets are there as well. And now here are some underutilized resources. We already talked about ones that, we frequently refer families out to. One that I definitely want to make mention of is the EOS/CATE/CFIT, which EOS is Enhanced Outpatient Services. CATE is Child and Adolescent Intensive Treatment Services, and CFIT is Child and Family Intensive Treatment. Those services are all the same. It's just different insurance providers call it a different name, but it is a very intensive support in the home for children that are having, emotional or behavioral needs. This is basically one step below hospitalization. Kiddos would be able to apply for this program to get those supports in the home as well. Another one, I'm not going to go through all of them because we'll be here all night if we go through all of them, but some of the resources that we help families connect to are things like, after school programs, social skills groups, mentoring type of services like Big Brother, Big Sisters, Boys and Girls Club. Let's say if a family is looking for some outpatient therapy, that could be speech, occupational therapy, physical therapy. We can help support or connect families to those services, as well as family support groups. RIPIN actually has a virtual parent support group as well. So if you are interested in something like that, you could actually just go on our website, ripin.org, and they'll have some information on that as well. And this is just a few, and I say a few when it's very much quite a few of different resources, but it's just a taste of some of the things that Cedar can help connect families to.
So this is what our actual referral and triage form looks like. I know it's really small on your screen and you're probably having a hard time making it out, but it's basic demographic information for the most part. The date, what your name is, how we can contact you as a referral source, the child's information, date of birth, address, parent, how do we reach these folks. But also it has an area for who the child's doctor is, if the child's enrolled in current care or not, is there a diagnosis code that's known. And where you'll see it's highlighted is the most important information on a referral form. And it's mandatory and required for us to accept the referral. And that is one of two bits of information. We need either the child's social security number and or their Medicaid number. And the Medicaid number is the 10-digit number that's on a child's anchor card. And you probably know what I'm talking about. It's the white Medicaid card that has a blue anchor on it, and it has 10 digits. Most parents don't carry around their child's social security card, so they may not know that number, but most parents will carry the anchor card, and so should be able to provide that 10-digit number. We do need one or both of those numbers in order to accept the referral. The bottom part is mostly for medical referrals, if you happen to, unless you happen to know this information, and that is based on the child's, whatever chronic condition that they may have or chronic conditions, and some further questions about where the barriers may lie, to explain why you're putting the referral in. So please, if you fill out a referral form, please fill it out as completely as possible, especially the first top, and that those two yellow highlighted areas are of utmost importance. So what is a family care plan? We talked about this earlier, and we said we'd go a little bit more into detail. It's an individualized plan for each family based on the needs assessment that is conducted. Each child has different needs. Each family has different needs. And we really try to get very in depth with the family to determine what goals do they have for their child? What goals do they have for their family? And then we help develop those goals together. And it's a family participatory program, meaning that it's not like we do for families, we do with families. Families are as involved in the FCP and reaching of the goals as we are. So the FCP identifies goals that are listed out. We take the action steps. The action steps are detailed, and we even have expected completion dates. Who's going to be responsible? Each step is responsible either by the parent or the care coordinator. Goals can always be added, removed, depending on the family's needs. And each family care plan is reviewed by our clinical social worker.
And this is just one example of what a family care plan may look like. For example, you'll always have the goals name at the top. So in this case, reduce Millicent's aggressive behaviors in both school and home settings. And then we break it down step by step, as Valerie had said. So in this first line here, you can see that in this example, at least, the goal was identified on October 1st, 2022. Then the action step itself was to contact the appropriate EOS, enhanced outpatient service provider, to discuss the referral. And it tells you right there that the Cedar Care Coordinator would be the person responsible to complete this step. And then when is that action step due? In this case, it would have been November 1st, 2022. And then it just tells you whether this action step has been identified, completed. Whenever we first start off with a family, all of the action steps will be identified. And then as we work with the family, we'll start completing those action steps. Typically, we will work with the family, 365 days to get these goals met. So typically you'll see that the family care plan itself will go up until that point. And then we can always remove or add goals depending on the family's needs. We know things change. It's a pretty hectic, busy world. So, let's say, for example, in this case, Millicent's behaviors vastly improve and she no longer needs EOS. Then we can remove that goal. But let's say now she's struggling with social skills, we can add goals. So it's truly tailored and individualized to each and every family that we work with. And now I just want to give everyone the opportunity if they have any questions at all. Sarah, I don't know if there's any questions in the chat.
I do not see any questions, but we encourage you, if you have specific questions, pop them in the chat. I did put some links in there for the fact sheets and the link to our website. And then, as Valerie mentioned, the link to the Spanish presentation that's happening. Oh, we have one. Is there a wait list? That's Janelli. Am I saying your name right?
Yes.
Okay.
No, Janelli, we very, very rarely have a wait list. There are times that we are more busy than other times, and maybe it holds off getting in contact with the family by one or 2 days, but generally we do not have a wait list. Now, the services, just to make this clear, the services that we may try to connect a family with has wait lists, but the RIPIN Cedar Center does not.
Okay, thank you.
You're welcome.
We have another question. I can't say the name. It looks like it's a screen name. Where would I find the triage referral sheet, or is that what you guys work off of?
So did we have that in the chat, Sarah? I can't remember.
Was that one of the handouts that we sent?
I don't remember. I don't remember, but we can put that in the chat.
Okay.
We can put that in the chat.
Okay.
Absolutely. And in the greatest thing, the best thing that you can do with that, once you have it, is to save it to your desktop, and then you'll always have it for any referral you want to put in.
I'm just going to review the things that we sent to our participants tonight. We sent the Kids Connect fact sheet, the Home-Based Therapeutic Services fact sheet, the Applied Behavior Analysis fact sheet, the Respite fact sheet, and the PASS fact sheet.
Okay. We will get that in the chat.
Okay.
Is that something that you could do right now, Jackie, by any chance?
I might have to stop sharing my screen is the one thing.
Yeah, that's okay. We'll do it right at the very end. We will get that in there. Okay. Let's see.
I'm gonna just include the links to those. Actually, it won't link to them.
You know what? I think I can.
Email.
Let's see. I think I can do this.
Peggy, I see you unmuted. Did you want to ask a question? No.
Yes. I was wondering what languages are these services provided to parents and guardians?
Any language. We do have staff that speak Spanish and Portuguese right now, but we do use translation services.
Thank you.
So
Because
whatever a family speaks, there's no barrier to services due to that.
Thank you, because I work in the Pawtucket and Central Falls, and there's a lot of Cape Verdeans, so I was just wondering. Thank you.
Yeah, yep, absolutely. No one is turned away based on the language that they speak. Mm-hmm. We utilize translation services.
And for anyone that is aware of Spanish-speaking people that may be in need of these services, I did put a link to, we're hosting this same workshop on Wednesday night in Spanish, so I encourage you to share the link to that for people to join.
I did put the link for the form. Feel free, somebody, to tell me if it doesn't open or if there's an issue. If you can try.
I can see it because I'm internal, but it might be.
Yeah, I just want to make sure.
And if not, Sarah, would it be possible to maybe send it out to the people who—
via email?
Yeah.
Yeah. So after this, I'll send another follow-up email just to make sure that you guys have all the links in the presentation as it was recorded and the slides itself, so we can give you this package of information.
Yeah.
Yeah.
And our fax number, just that you also know, the fax number is right on that referral form. So when you go to fax it, it's right there at the very top.
Super.
All right. And were there any other questions at all in the chat, Sarah?
There are not other questions. That was a thank you from somebody. And
so we have a couple of, on the next few slides, we have a couple of examples of what makes a CEDAR referral I'd love to go through those with you if you'd like to participate in that and take your best guesses. So it's almost like a little game. Is this a CEDAR referral? If the child is 6 years old, his or her diagnosis is that they're on the autism spectrum. They have attention deficit hyperactivity disorder, mixed receptive expressive language disorder. They have aggressive behaviors and not potty trained yet. Been hospitalized twice at Bradley in the past 12 months and has neighborhood healthcare right care. Is this a CEDAR referral? Someone feel free to just come on in and take a guess at an answer. Do you think this is a CEDAR referral?
Absolutely, yeah. All day, every day.
Yes, absolutely all day, every day. This is absolutely a CEDAR referral. Great answer. Let's try another one. Now we have a 12-year-old. Diagnosis is Down syndrome, failure to thrive, and has a learning disability. His or her social activities of daily life are very limited. The family is in need of transportation. The child is G-tube dependent. The child wears diapers or briefs. There's a single parent, very limited resources, has right share / Medicaid. Is this a CEDAR referral? Oh, I'm sorry, I missed one. Spanish speaking only. Is this a CEDAR referral?
Yes.
Yes, it absolutely is. Now we have a 20-year-old. Diagnosis is autism spectrum disorder, attention deficit hyperactivity, and anxiety. 20-year-old is nonverbal, inappropriate behaviors at their school placement, has a history of psychiatric hospitalizations in the last 12 months, lives with parent. Parent doesn't have guardianship or power of attorney, is unwilling or unable to obtain it. And a 20-year-old has Katie Beckett. Is this a CEDAR referral?
No.
No. The only thing on the list, what's the reason?
The age.
Nope, age is fine. We go up till age 21.
Oh.
Yes, it's that the parent doesn't have guardianship or power of attorney. Child is over the age of 18, so we would need one of those. If the 20-year-old, if the young adult cannot what do I want to say? Sorry, speak for himself in the program and help develop his or her own goals. And the parent, if he or she can't, the parent would need to, and therefore would need guardianship or power of attorney.
All right, is this a CEDAR referral? This kiddo is 10 years old. They're diagnosed with oppositional defiant disorder. There's some school-related concerns. They are independent with activities of daily living. There's no history of medical or psychiatric hospital admissions. The family is overwhelmed and looking for support. Is this a CEDAR referral? And feel free, you can just blurt it out, put it in the chat, whichever.
Oh, is there some
Yeah.
questions?
No, is this a stumping one? I don't see any answers.
I think it is. All right.
I'm guessing yes. I'll throw myself out there.
You could be correct. This definitely is a tricky one. Looking at this kiddo's age, their diagnosis, the concerns, typically this child could potentially be a CEDAR referral. Where there is a bit of uncertainty is just because we don't know what kind of insurance this kiddo has. So do they have Medicaid or do they not? So this is one of those cases where, if you're sitting with a family who is kind of having the similar situation, they can always call us and we can definitely help them, figure out if they are a CEDAR referral. Now, is this one a CEDAR referral? This kiddo is 24 months old. They were diagnosed with developmental delays. They have United Healthcare, Medicaid as their insurance. There is a history of hospitalization admissions in the past 12 months. The family is overwhelmed and looking for support. The family is currently working with early intervention. Is this a CEDAR referral?
Come on.
Oh.
Say again, Janelle?
I'm gonna guess no.
And this is another tricky one. So typically, when a family is working with early intervention, they'll stay with them until they're typically 36, around 3 years old. Sometimes we will work with some families who are in that transition period. So they might be, 2 years old and a few months or so. And we can help with that transition period as well and get them started with CEDAR services. So this is another one where it's definitely a trick question. We definitely do need a little bit more information to see if this kiddo would qualify.
And just to add on to that, early intervention in CEDAR, we kind of do the same work. But early intervention is very tailored to those young kiddos up till age 3. And then at 3, they can transition into CEDAR. Once in a great while, there'll be some additional reasons why we would work alongside early intervention with a family that's younger than 3, but it is pretty rare. So under the age of 3, you just automatically go to early intervention.
And if by chance anybody has any additional questions or might want to, get situated with Cedar, this is our direct number. It's our extension 365. Our email address is here as well. And our website, Facebook, Twitter, whichever works best for you. And since we do have a bit of time, I just want to pause in case anybody does have any questions at all right now.
Yeah, feel free to type in the chat or unmute yourself if there's anything specific.
And if not, I know Sarah will be posting a survey in the chat. If you could please take the time to just fill that out. I don't believe it's very lengthy by any means, and it just helps us improve and grow as presenters as well. And did you have anything at all else to add, Valerie?
No, that's it. That's it. Thank you so much for joining and learning a little bit more about RIPIN. I know sometimes when I have sat in these kind of learning opportunities, the question pops up about an hour later. So as Jackie said, please feel free to reach out to us anytime. The 2700101 is the RIPIN main line. Cedar extension is 365. It is a confidential line. You can leave messages on it with names and anytime, and we'd be more than happy to call you and talk anything through with you, whether you just have a question or want to discuss a potential referral. Would be more than happy to help. So please don't hesitate. I'm hoping we answered your questions and that you learned a little bit more about RIPIN Cedar. Thank you.
Yeah, thank you. We're getting some thank yous in the chat.
Thank you. Have a lovely evening, everyone.
Yes, you guys are great. Thank you. Thank you.
Oh, thank you. Thank you.
Thank you so much.
Oh, thank you.
Thank you.
Thank you.
You're welcome.
Bye-bye.
Bye-bye. Have a good night.
You too. Thank you.